Hello, YouTube fans. This is the Fred and John Talks. You may find us a little different today because Fred is not sitting here. Fred is somewhere else. Hey, Fred, are you there?
I am here.
Hello, Fred.
Hello.
Say hello, Fred.
Hello, Fred.
Thank you, Fred.
I'm your cameraman today.
Fred is going to be the cameraman. But today I'm wearing my father's Greek fisherman's cap because this is the studious talk. So I'm going to be pretty serious today. I'm going to be doctor, and I'm going to introduce you to Russell Leaderhouse, who's our guest.
Hello.
Hello, Russell, who is an accomplished pharmacist. One thing we need to get out of the way straight off, Russell, is I thought that you became famous when you were younger, or your family was famous because your family designed Lederhosen clothing, or the kind of shorts that men wear in Germany.
Yeah, those little fancy leather pants. That is true. That's our family heritage. That's the Lederhosen or Lederhouse when it was Americanized. So.
Are you still living off the revenue of that?
Oh my God, I wish we were. I wish we were, if only.
So your family actually designed clothing like that?
Yeah, that's the family going back with the lineage and the heritage. We actually came back from like the Germany-Austria border, and that's what we were known for, is like the Lederhosen, making those over there. And then the family immigrated over, and they had to Americanize the name and not be Lederhosen anymore, so they changed it to Leaderhouse.
Leaderhouse.
Yep.
Cool. Wow, that's very interesting, fans.
But yeah, that's what they were known for.
So tell us a little bit about your bio so we can start working our way into pharmacology and pharmacy.
All right, so I am a licensed pharmacist, been practicing for over 20 years now. I've had experience doing retail pharmacy, long-term care pharmacy, in which that's for nursing homes, even penal correction facilities, prisons, regional jails. I've had my own compounding pharmacy, very familiar with compounding pharmacy. I do consulting pharmacy on the side, help out with a veterinary school, and I'm the consulting pharmacy on staff with them, and just general knowledge that I've picked up throughout the years, and I love the world of pharmacy and drugs, and it just comes natural to me in trying to help people out with that.
I would say that's very true. And I'm trying to remember when I discovered you and became kind of friends with you is during the compounding phase, I believe.
Right. That's
here in Winchester. When I was practicing medicine, I think one of my advertising hooks was wisdom for women, and I was really interested in Premarin and compounded estrogens, and I think I used to talk with you about that. That's kind of when I discovered your compound pharmacy. Is compounding still a big thing now, or is it really on the wayside?
No, it's still a big thing. It is definitely changed. It's become a lot more regulated. Therefore, there's maybe not a lot of them around, but the ones that are doing it will definitely be doing it the right way. A lot safer now. They realize some of the hazards with, like, especially a lot of the hormones with like the estrogen and progesterones, and they've had to implement a lot of safeguards and like negative pressure areas, and make sure that they're doing like the gowning and gloving and like the handling actually for like the pharmacists, the technicians in the actual pharmacy doing it. But I can tell you the ones that are doing it now, they're definitely doing it the right way.
Well, I always wondered about Premarin back in the 70s, 80s when I was treating women for menopausal symptoms. And for those viewers out there that don't know much about Premarin, Premarin is derived from
Horse urine.
Horse urine.
Yeah. Premarin stands for pregnant mare urine.
Yes.
They would get a horse pregnant, then they would collect the urine from the horse, and actually then they would extract like the conjugated estrogen. So they really didn't know exactly how much or what they were getting, but they just knew there were estrogens in there, and then they would conjugate those down, put it into a tablet, and that's what we were giving females. A lot of them was a very popular drug that a lot of women were taking.
Several decades. And I remember talking to reps from that pharmaceutical company, and they couldn't tell me how many different estrogens there were in horse urine. Some of them had not been isolated yet. That always kind of bothered me, Russ. I always wondered whether some of the yet unknown agents of estrogen in the urine could have been responsible for breast cancer. Did that ever cross your mind back in the 70s and 80s?
Well, the 70s and 80s, that was a little before my time. But however, there was some studies that came out with the oral estrogen, such as the Premarin and Prempro that the females were taking,
Yeah.
and there definitely was a correlated risk that they saw for the oral estrogens and breast cancer and other issues. And then at the time, a lot of the compounders were saying, well, don't do it orally, do it topical, therefore it transfers through the skin. So instead of going through like the stomach and the liver and getting metabolized and going to the body, well, let's put it through the skin and go through into the body, bypassing the liver and that metabolism. And a lot of the compounders and pharmacists at that time said that's going to be a better option for this. But with big pharmaceutical, like, nope, Premarin, that's the way. But then some of the studies came out and realized, no, that really wasn't the best way.
That's why I started prescribing the patches and topical creams,
Yeah.
I think, over time. And that's where we are today with
That's where we are today with big pharmaceutical, and it all started with compounders coming out with it. So, I mean, compounders know what they're doing and what they're talking about.
They were using plant estrogens.
Yes, we were.
Yeah.
Yep.
So one of the things that we do on Fred and John Talks, we're very much into mental health and trying to help people, especially with loneliness, anxiety, depression. And so basically one of the reasons I invited you to come and talk today was about mental health issues, some of the medications that you have expertise in that treat these types of disorders. So can you just generically give us a quick sketch of how do you see mental health going in the United States today? What is the number of prescriptions you're filling that are going up or going down? Where do you see that sort of issue in from the pharmacist point of view?
Definitely going up. Definitely being talked about more. Seeing more prescriptions coming through, which is a fantastic thing because it's something that we can't just be quiet about it. Suck it up, deal with it. Oh, I'm just gonna I'll have to deal with this on my own, because that's not a good situation. If you realize there's an issue, or even people around you realize there's an issue, let's start talking about it. Let's start addressing this. And I am seeing more prescriptions and more people coming out and getting this. Yes.
What about age groups? Younger age groups?
Oh, no, this is across the board.
Across the board.
It is across the board. I would say maybe not so much in the elderly community, and that's something that I'm kind of curious about. And hopefully that would be addressed more. But I am seeing it more in teens, young adults, and then even like especially in the males, like that 30 to 50 demographics, I'm seeing a lot more of it there, at least with prescriptions that I'm seeing coming through my pharmacy that I'm filling.
You know, when Fred and I have talked about loneliness several times, we've discovered that the younger age groups, even the teens into the 20s, are having problems with loneliness, spending way too much time on electronics and their phones and communicating in ways that they think they're connected with people and they're not. They're not doing what you and I are doing today.
Oh, the face-to-face conversation? No.
It's become a dinosaur. What we found is that in Australia, England, all over the world really, older populations, the 65, 70-year-olds, they're actually more adaptable to loneliness. They've been able to, over time, adapt to the loneliness situation. Or the young kids don't have the experience. They don't have the time on the clock. They don't have maybe the input from their parents or some other person to help them struggle through loneliness. So that kind of maybe parallels with what you're seeing in the pharmacy. Is that maybe the older people aren't getting as many drugs filled, or they aren't? I didn't get that.
Well, they definitely are, but I'm seeing an increased number in insurgents of the younger.
That's what I'm thinking.
Yeah, the younger and the middle aged. I'm definitely seeing more so now than what I have in the past.
Okay. And compared to depression or anxiety, where do you think more prescriptions are going in terms of that?
Oh, there's an increase across the board for people getting that stuff and getting it filled and getting it. Yep.
One of the interviews we did several sessions ago was with Dr. Andy White, who's a family medical doctor who's totally devoted his time to psychiatric issues and depression. He wrote a book called Mending a Broken Mind. And he brings up some of the medications such as ketamine that are being used today. He actually said it's a wonderful drug. Could you fill us in a little bit about what your thinking is on ketamine?
Sure, love to. I even have like a personal story to where ketamine's a special drug in which it's not dispensed at your typical retail pharmacy.
Okay.
So you just don't walk into your local giant CVS or Walmart and get this filled.
I didn't know that. Okay.
It's not in that situation. It's going to be more of in a specialized clinic situation. In fact, like I had one colleague that I worked with that went through this, and I was fortunate enough for him to actually open up and tell me about his experience. And what I can say is, in working, he had a very traumatic experience, and he did open up and tell me about that, and I can understand it. It wrecked his life. It really did.
And so he was taking ketamine for depression and.
Well, no, this is beforehand.
Beforehand. Okay.
This just happened, and then since that traumatic event, I can't tell you how many different medications and therapy options and that he went through. And he just went from next to the next to the next. And he was down and out to pretty much at work. Like, he may show up, then he might have been there for an hour and a half. And then say you have to go on a break because like all of a sudden he would start having a panic attack.
Oh boy.
And then he would go out to his car and he's like, I just can't make it back in. And then I know that he started to self-medicate, and he was using alcohol and other drugs, and just because nothing was working for him, and he felt lost.
He was searching. Yeah.
And he felt that nothing was helping, and he just could not get past this. To where, I mean, he even went so far as, I think Dr. Andy and the one that talked about like the ECT that like
Electroconvulsive therapy.
yes,
Yeah.
thank you. To where he had that, and like he told me like they were like trying to stimulate different parts of his brain, trying to help out, and nothing helped him.
Nothing worked.
I mean, he was like severely depressed and just couldn't function in life. And then somehow he found out about this ketamine therapy.
That's what Dr. Andy White was talking about. I think he mentioned that he thought it was almost like a wonder drug for certain patients in psychiatry.
But now the other thing I'll tell you, it is some people are a little about it because it has been used and abused on the street.
Okay.
It's ketamine or Special K, and it's been a club drug that people will get, and like it's a dissociative, it's a hypnotic, it's like a tranquilizer.
Okay.
Is what it is.
All right.
You know, and it can be used and abused by people, and that's why some people have a bad mindset about it. But I can
It
also
was
tell you,
used in medicine. Some of the anesthesiologists would give that in.
oh, absolutely,
as
that's what it's used for. The
Yeah.
anesthesiologists will use this to help put people down.
Right.
And like for surgeries or for different procedures, and it's fantastic for that in the right environment. But then what they found is in sometimes when they were using these on people, it was one of those like serendipitous moments to where like, wait a minute, we put them down, and all of a sudden they're having a better response to like their like post-traumatic stress disorder, and now they're able to deal with this better. Well, what happened during the surgery or during the process that helped improve them now? And eventually they were able to put those two together and realize that, hey, there's something here with this ketamine stuff. Let's explore that. But ketamine is one of those weird drugs to where some people may have heard of it as a K-hole, in which you take it.
K-hole.
Yes, as in ketamine K, and a hole, like you're going into a hole.
Consciously or just the way it's affecting the mind?
Yes.
Okay.
So you can think of it like if you take a little bit of it, you will feel the effects of it. But then essentially you get to a certain threshold, and then it's like almost like your body and like in your mind, you just become relaxed, and then you go into this, how it's been, I've never taken it, but how it's been described to me by various people is like your body's kind of going through this tunnel or through this hole. And sometimes that can be a little traumatic for people if they don't realize what's happening.
Okay.
So in the case with this gentleman that I was talking about, he was actually going to these therapy sessions, and he had like a handler, like a caretaker, a nurse that was there with him, that they would administer, and this is with a nasal spray, that they would give him the ketamine.
That's the commonest way it's used now.
That's how it's being used now, at least in this lab, in this setting, is they have it and it's FDA approved, and they're being utilized in these special situations to where it was administered nasally, and then he would be in a room, and there was a chair there was a bed there, they could turn on music if he wanted music, they could turn on the lights, turn off the lights, he could get under the covers of a bed, whatever would make him the most comfortable in that situation.
Okay.
And in this case, it was a female that was there and would talk to him. And they would talk about, okay, what are the issues that he wanted to address before going into this therapy? Because he would get dosed, and then he would be there in the room, and then she would kind of, just for safety factor as well, be there with him in case something went on. He said that they would monitor his heart rate and his pulse and respiration and all this other stuff.
It sounds like to me that it was a little bit of counseling or psychiatric intervention going on with.
Yes, because he would also go to, like, it was a therapy session that they would have a therapy session beforehand and talk about it. At least in his situation, what he was telling me, his thing was, like, they would meet, they would talk and have, like, a therapy session, and then he would actually go and get dosed, and he would be in the room for the therapy, and this may last anywhere from 20 minutes up to 2 hours, or whatever time period he needed to be there for.
Okay.
Yes.
From the Peanut Gallery over here.
Hi, Peanut Gallery.
Hey, can you speak to, and if not, that's fine. I hear a lot about the keto diet now. Does that tie in with ketamine? That's part one of my question. And part two is, what is ketosis? I've heard a nurse practitioner friend of mine talk about ketosis. Can you speak to either or both of them?
Yeah, with the keto diet, that is more of eating higher protein and vegetables, limiting carbs, and kind of forcing your body into a ketoacidosis, which actually helps your body process like fat and metabolize differently. But that's different than what we're talking about here.
Okay.
That's to help burn fat and lose weight, isn't
Yes.
it?
It's different than what you're talking about.
Very
ketamine.
similar sounding, but two different elements altogether.
Okay.
So just completely different.
Okay.
Now, in that, the ketosis that you're talking
Yeah,
about,
please
that's kind
talk
of like
about
that K-hole that I was talking about. Because some people, when they're going into that, it's like they're going into a hole or into this tunnel. And then, like, in their mind, they are down in this element. And whatever's going on in their mind, they're actively in that. But the body is unable to respond.
The whole thing about going into a hole, that has a negative connotation, like they're sinking, they're not functioning well.
Well, I wouldn't say negative. It depends on the person.
Oh.
Once you're used to it and talking with these people, then they know, okay, here, now I'm going, and they look forward to it.
What to expect.
Yes.
Okay.
So it's almost like if they're at like the top of a slide and you're sitting there, then all of a sudden the gate opens and now you're going down the slide. Some people get freaked out the first time because they don't know what that slide's going to be like. But then other people are like, okay, here we go, and now I'm kind of going to where I need to be so I can address these issues.
Gotcha.
But it depends on the person, and that's why there was like that caretaker or handler there to help them transition into that process. And then he said after he did it, the first time was a little uneasy and unnerving, and he really didn't get there too much, and he was fighting it.
Trying to resist getting into that status.
Yes, because he just didn't quite realize what it was going to be like for him.
Okay.
And he was a little freaked out. But then once he got there, he was, okay, this is what it was. This is how this is going to work. But then he was fighting it so much that he didn't get the full benefit of the therapy.
Okay.
But thankfully, like, she was there, she was helping him.
Yes.
And he said, if he would have done that on his own, it would have been like the worst trip, bad experience that, like, you don't want to do this on your own.
I'm kind of wondering, hearing you talk about the medication, ketamine, used in depression, shouldn't it be really highly supervised? And it kind of worries me that people would be given the prescription, and who's counseling about all these effects and possible effects?
Again, that's why this is not, you're not going to be picking this up at your local drugstore and taking it home with you and doing this.
Okay.
It is going to be in that
supervised
at least that's how it should be done, and that's how it's being done at these clinics now.
Okay.
As best I understand. And like that is how this is going to work.
Okay.
To where if you do this at home, I mean, perfect case is Matthew Perry, the actor.
Oh, he just died recently.
Yes. And it was said that he actually had ketamine in his system when he passed away. But ketamine and like its half-life and the metabolism and how the body handles it, it goes in, it goes out pretty quick. It's not a long-acting drug that sticks around for hours and hours or days or weeks.
You can't pick it up in the urine weeks later if you've taken it.
No. I mean, you could probably pick it up, like if you do it now, you're going to pick it up like within a day to 3 days.
Okay.
But a week from now, 2 weeks from now, no, it is not going to be there.
All gone.
It's unless they're taking it continuously. Well, in his case, he died in the hot tub.
Yeah.
And they had ketamine in his system, but he was going to these clinics, but really it wasn't from his therapy sessions. He probably had it at home, dosed himself in the hot tub or before that.
I see.
But then that catatonic state that you mentioned, I mean, if somebody, once they're in the K-hole, you can go up and you can hit them, shake them, and they will not respond. They are just They are in the K-hole. They are comatose. They are catatonic. They will have a very hard time responding.
You said something before we filmed that you can throw water on somebody like that, and
and they may not respond at all. So that's why it's very possible that he did this and he went into this state, that K-hole, and he could have been experiencing in his mind what he's experiencing and trying to deal with. However, his body could have just relaxed and he just went down into the hot tub and he was under the water and he drowns. But he doesn't recognize his physical body being in trouble because he is in that situation with the ketamine. And like it's that it's that anesthesia drug that just puts you under, so you can't just snap out of it.
Can't respond.
So that's the danger side. So it's not something you want to do at home.
Correct.
Like you don't want to do this by because there's good stuff with this, but there's also bad, and that's why you can't. You got to be careful with all this stuff.
I am so glad you brought up some of these fine points and distinctions, because whenever Dr. White talked about ketamine as being a really super helpful drug, I don't think he expanded into the concept of clinics, the clinical use, and the guardrails that need to be in place, perhaps with clinics and supervision. So that's very, very useful information, and I hope our YouTube viewers understand that ketamine is not something to play around with.
No, it's not something you just want to go ask your doctor or go find and just take, because I mean, bad things can happen. And if you're not familiar with stuff, you don't know what the dosage is going to be. You don't know how your body's going to respond to it. That's why it's best that they're doing these in these clinical situations, because you have somebody there in case something does go awry, does go sideways.
Yes.
They can help you.
Yes.
And they have. Yes, Peanut Gallery.
Peanut Gallery.
Can you be more specific about these clinics? I mean, where would a person go?
Okay, so case in point, this one was in, again, the gentleman that I'm talking about, he went to Northern Virginia. I never asked specifically where this was, but kind of, I mean, I know it was inside the Beltway in Virginia. So I'm thinking Fairfax, Alexandria, Arlington-ish area. I never got the name of the clinic. I didn't get into that with him.
Okay.
I was more concerned of seeing him for what he was before, where he could barely function. I know that he was abusing alcohol. He was also on medications such as clonazepam, and he was on all these other, but then I know he was abusing the clonazepam. He was abusing Ambien as well. Then he was drinking on top of these. And it was just a bad situation all around.
Did he ever get back to work and functionality?
He did.
He did. Okay.
But I mean, we actually had him on like an action improvement plan to where look, you need to do this stuff and start showing up or you're going to get terminated. And then thankfully he found out about this clinic. And he actually took some time off as a medical leave, which thank God he did. And he went to this, and all of a sudden it was a complete 180. And he turned around, and he was able to start showing up. He was functioning. Then he actually started going back to school. I mean, it was like a whole new person. And it was all because of this and how he was able to really grasp what happened to him, deal with this, and then move forward with it.
Do we have any such clinics in the Winchester area where we live?
Not that I know of.
So the question was from Fred, do we have any clinics in Winchester, Virginia, where we reside? And you're saying not that you're aware of.
Not that I mean, there may be, or there may be coming, or hopefully, and here's the other thing. I know people who are actually studying and taking online courses to become like that nurse, like that practitioner that's
like
actually sitting in there.
Like a facilitator.
Yes, like that facilitator, that handler. Like she's going to be there and she walks and talks them through this process to let them know. And I know that's what she wants to get into because she dealt with issues in her life and she had somebody that was able to do that for her.
Okay.
Now she's interested in learning those aspects and wants to get into that. And I know she told me there are clinics in Virginia, but I don't think she never mentioned anything here like the Winchester, Front Royal, like Northern Shenandoah Valley area.
Okay.
But God willing, hopefully one day there will be.
Yeah.
I mean, just to know the benefit of the stuff that I've seen for people.
Thanks, Russ.
Let's shift to another topic that people might have on their minds. That's CBD.
Okay.
Do you think CBD has any role in helping depression and anxiety? What do you see as a pharmacist as maybe the best usefulness for CBD?
First, tell us what that stands for.
Yeah. So CBD is one of the components that actually comes from the hemp plant or the cannabis plant.
From the cannabis
So you have THC, that is the active psychoactive component that it's in cannabis, that's in marijuana, that's in pot, that people smoke and that's what gets you high.
Right.
CBD is another one of the components in that, but it is not psychoactive. You do not get high on this stuff.
Is this an oil, like an extract?
It can be. So you can get it. They actually grow hemp cannabis that will have high concentrations of THC and no CBD, or flip that and it'll have
Oh.
super high concentrations of CBD but no THC to speak of whatsoever. So you could sit there and smoke that all day long and you are not going to get high. However, you may get the benefits of helping out with some anxiety, helping out with some like pain, with some inflammation.
Okay.
And then you can do that as like with cannabis as a flower with the CBD, where actually you would smoke, or it can be put into like extracted as into an oil, or into edibles that you would just eat, or into a gum, or they even have it as topical gels or creams. I mean, they have it in pretty much everything right now.
So, is the ratio or the content of the difference between the CBD and THC, are these labeled on products so that the public knows what they're getting or not?
They are getting a lot better with that now, and yes, they are.
They are. Okay. Because I
So-
can see some dangers with the wrong ratio.
Yes. And there can be, and a lot of times before this, and see, this is the good thing that came, like, there was the Farm Bill that enacted to allow us to actually grow hemp and have the CBD and make it legal.
Right.
And now there are companies that are actually doing it the right way.
Good.
And they are extracting this stuff out. They are labeling it, and they are testing it, and they're showing what the impurities are, and they're actually doing it the right way. So yes, you can see what the concentration is, what the dosage is, and if it's going to be a half a milligram of the CBD, and that way you kind of know if you're doing it as an oral, like a capsule or a gel or a gummy or even a topical, what it's going to be. And some people will get great benefit from this. Other people, it's not going to do a thing.
you
But it's
think-
like some medications. Some work fantastic and some don't.
Do you think a physician should really be prescribing the ratio or the change? Can they start off with one lower level of THC and go up in THC, or start higher and go down? I mean, is that something a physician or somebody should be
Yes.
prescribing?
Well, I would say they should be aware of it, knowledgeable about it, and recommend it in certain situations. Because here's the thing. You, in Virginia, and in a lot of states now, you can get your medical cannabis card. And it's not where you go, again, then you're not going to a local Walgreens, Walmart, CVS, whatever,
It's a
to get this
specialty
stuff.
pharmacy type of
But
situation?
it's a dispensary, and then you have to essentially go and see a physician. You tell them what your situation is,
Okay.
and then they will give you a medical cannabis card. Then you take that card, then you can go to a dispensary,
And that's all
and
legal
that
now.
at dispensary you can get different products, the cannabis that would have the THC in it,
Okay.
or they would have the CBD in it, and in certain ratios. And there's different strains that help for different people. So it could be more for pain, it could be more for anxiety, it could be more stimulating. So if you're just like a down and depressed person, it could actually help bring you up. Or there's strains that'll help increase your appetite if you're just not eating.
So it's pretty specific between the THC and CBD oil.
Yes, and knowing the different strains and how it reacts within the body and with that person. And there's been a lot of research by the growers in the cannabis community for all this stuff. I mean, one case in point, there was a specific brand called what they called Charlotte's Web. And
I've heard of that.
You've heard of this. Okay. This is from a while ago, and this is back when it was super controversial and nobody had
Early on.
medical cannabis. Yeah, but this is super early on. And this was for this little girl, Charlotte, in which she had like uncontrollable seizures. And like she was on all these different medications and nothing was controlling this stuff. So, I mean, I couldn't even tell you how many episodes she would have a day. And then all of a sudden they tried this CBD oil for her, instantaneously stopped.
Bingo, I remember that.
You know, and then
the parents went on television and talked about
Yes.
how quick it was.
But then I mean, and I even know that some people, like when the state that they were living in and their children had this because they found out about it, but they weren't allowed to do this within the state. So they even had to relocate and move to a different state
Oh,
out
they
to
did?
Colorado
Oh, I
to
didn't
get
know
this
about-
stuff,
didn't know about
which
that.
allowed for all this.
I see.
Whereas, but if they brought that same product, because they were living in, let's say, this person may have been in Ohio for this one documentary that I saw, well, they could have been arrested for bringing that from Colorado into Ohio to help treat. But it's the one thing that actually stopped this for their
seizures.
kids. You know, but it's one of these things like these companies, these cannabis companies, they've grown specific products in like through genetic testing and like manipulation. Like, okay, so we're going to just get CBD in this. So like how we have crops now that like we've increased our production and we've done all this certain things, but they've done that within the cannabis community, within the hemp community, to get you really high concentrations of CBD, really low concentrations of THC, like this Charlotte's Web version that we're talking about that they did years ago. And then that CBD has made all the difference in the world for some of these people.
Let me pause. There's a peanut gallery question from
Yeah.
Fred.
Can you speak to, are there any negative implications of people who are already on, people with mental health issues, already on psychiatric medicines? Should they avoid CBD, mixing those? Is that toxic, or can they use both?
Short answer, they can use both, but it depends on how they respond. Because look, with any medication, you never know how you're going to react to it until you take it.
Individual response.
I mean, because they'll have everything listed to where nausea, diarrhea, heartburn, blah, 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 all this stuff. And you may get one of those or you may get all of those. But you really don't know until you really try it. And then it depends on how your body responds to it, how your body metabolizes it.
Yeah.
And some people will do fantastic on it and it'll help them. Other people, it may not do a thing. Or it may actually make your anxiety worse just because of how they are responding to this.
I asked the question because, I remember reading an article that said people who are already on antidepressants shouldn't take over-the-counter things like St. John's wort, or HTTP or HT.
Some herbal compound.
Yeah, over-the-counter stuff.
Well, and specifically what they're talking about there. So let's say you're already on an SSRI.
Yeah.
Or even like a dual action SSRI and like and you start taking St. John's wort, or you start taking 5-HTP, serotonin, you can actually develop too much serotonin and get into a situation called serotonin syndrome that can be quite serious. It could put you in the hospital. So that's one of the situations to where you don't want to take an SSRI with St. John's wort or with this. But I mean, it even goes to like other medications like tramadol will help to increase serotonin levels. But then if you need something to help you sleep, but then you're on trazodone, which it's not a specific sleep medication. It's more of like an old school depressive medication. But the side effects are so sedating that they put people, and a lot of people use that for sleep, and it works fantastic for people. But you start to get the combination, and then if you're doing over-the-counter products as well, then you could actually be getting too much serotonin, which could lead to that serotonin syndrome. So that's kind of one of the things that they're talking about.
Excellent. Thank you. That's
I remember
very
prescribing trazodone to some of my patients for sleep. Is that still commonly done for
Very much
helping
so.
rest?
Yep.
Okay.
So a specific med I have questions about because I've heard good and bad about it. Seroquel.
Okay.
Can you say anything about that? I hear it's good for sleep.
Yeah, well, again, Seroquel is another one of those psychiatric medications that can be really beneficial for people. But one of the side effects, sedation. It will just knock you out.
Okay.
So you don't want to take this first thing in the morning, or else you could be dragging all day. And you're going to want to have like 6 cups of coffee or a Red Bull or something else just to kind of get through. But you take that at bedtime, and it does help. It'll stick with you throughout the next day, and it'll help you fall asleep, especially if you have issues for like if you just have insomnia to where you have a hard time falling asleep or staying asleep. Seroquel is one of those drugs that could actually help out with that.
Thank you.
Yeah. Now, the only other thing I'll tell you, though, is some of those medications, you also got to watch out for weight gain. And not so much it'll make you gain weight on its own, but then I'll just tell people, like, all of a sudden they find that they're going to start eating that bowl of cereal more often than not right before bed. And you start getting those extra calories and those carbs, and you're doing that. And if you're doing that every night, well, you're going to start to put on weight. But it also may make you a little hungry, and a little sleepy. But yeah, if you just want to get that nighttime snack before you go to sleep, and then when you keep doing that, then you're going to have a weight gain issue. So, I mean, there are certain, like, there's just little things that, like when somebody comes in, I'll just kind of warn them about that. Or like, okay, well, I've started this, but now I've gained 10 pounds. I'm like, okay, well, let's talk about, has anything changed? Are you snacking more? Are you eating more? Or like what's going on? And sometimes it is. Like if you're on steroids like prednisone, you will just gain weight. You will swell up and you will retain fluid and all that stuff. While other medications, it's kind of like an indirect because people just start eating more. They don't really associate it, but they just do that. So.
At this point in the video, I would use the expression that's often used. It's complicated. Every question.
It depends on the certain situation and what's going on.
That's why we're so grateful you were willing to come and share your knowledge with us today.
Russell, we're winding down, and I'm thinking about what would you say to people watching this about becoming a pharmacist? What do you think about the whole career as a pharmacist? Where do you see younger people today who are educating themselves and electing to take on debt? What about the whole field of pharmacy as becoming a pharmacist?
All right. I'll talk about pharmacy for a little bit. It's a doctorate degree. So you graduate, everybody is a doctorate of pharmacy.
A pharmacy, okay.
Yes. Short course if you do everything correct. Like if a student knows coming out of high school they want to be a pharmacist, or I know right now I want to do this and I want to become a pharmacist. It theoretically could be done within a 6-year program where you do 2 years of like undergraduate and you get your prerequisites and everything, and then it's actually 4 years at a pharmacy school.
Okay.
And sometimes, like some schools will have like the undergrad, like a pre-pharmacy to get those out and everything. You like at Shenandoah, you can do 2 years at Shenandoah Pharmacy. That's here in Winchester, Virginia. That's actually where I went. You could actually do like their pre-pharmacy, knock everything out, and then from there transition into the pharmacy program. That's 4 years, so 6-year period.
Okay.
I took 10 because I didn't think about pharmacy when I was in undergrad. I was initially thinking that I was going to get into medical or do something else. But I was actually like a dual degree. I was in biology and chemistry. I was always in the lab. I thought that I was going to be going into like some other type realm. But it was weird that pharmacy my life just kept diverting back to pharmacy.
That's why you're well-rounded.
Yeah, so I mean, I was doing other stuff, but nope, you're going back to pharmacy, kid. You're going back to pharmacy.
So you think there's a good career for young people to consider pharmacy?
It
But
is.
they've got to look at 6 years at least.
At least. And it's not cheap. A lot of the students now, like I came out of school, I already had undergrad paid off, thankfully. But then I was $120,000 debt coming out of pharmacy school. Now it's easily twice that.
Wow.
If not more.
Okay.
And then the other thing that I find that's a little disconcerting for me is that I'm finding now a lot of new grads or the students haven't actually worked in pharmacy before they go to pharmacy school.
Oh, really?
Which I find very odd. How could you?
That helpful to be like an intern or something like that?
Yes, or even as a technician or something, just to see what it is really like.
Yes.
Because pharmacy, I'll be honest, is not an easy job. We are one of the only healthcare providers that is 100% available all the time.
Yeah.
You can just call the pharmacy and ask a question. You can just walk up to the pharmacy counter and ask a question. You can't do that with your eye doctor or like your regular physician.
You're very interactive.
Yes.
That's true. I like
And here's the other thing. It is very fast paced within a pharmacy. Our typical shifts are anywhere from 8 to 14 hours. We don't sit at all. We're standing the entire time. We're constantly moving. We're constantly going.
You don't see pharmacists sitting down.
No, there are no chairs or stools within pharmacies. And like you may be there just for that 10, 15-minute period and you think people are running around, then all of a sudden it quiets down. No, it's like that from the moment they open to the moment they close. It's just constant go, 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 go. And that's kind of a lot of the new students, they get in, they're like, oh my God, I didn't realize it was like this.
So they need some work-life experience in a pharmacy to get a feel for what's
should do that with anything.
Yeah.
I mean, that's what I feel like. If you're going to become a mechanic or if you're going to become like a dairy farmer, work in that field for a little bit to figure out, do you actually like it or is it going to suck and you don't want to get into it?
Good advice.
But I mean, it's like there's constant, like there's phone calls, there's prescriptions I got to check, but there's people walking up, but then you got to manage all the other aspects of like the technicians around you. And then you got prescriptions coming in, and then everything goes through the pharmacist. So, I mean, essentially, like you come in, like you drop off a prescription. Well, I may type that in, or a technician may type that in. But then I check it to make sure that everything was typed in right. Right person, right drug, right direction, right everything.
Check, recheck.
Yes, and then it goes to get filled, and then it comes back to me to make sure that everything was filled correctly. Then also look for all your drug interactions, or if there's any issues there. And then in the meantime, I may have 2, 3 other phone calls, or somebody else is coming in, or I got some other issues.
Fast paced.
So it doesn't stop. And then the other thing that's happening is a lot of physicians' offices aren't doing vaccinations anymore. All of that's being driven and sent to the pharmacy.
That's a whole other topic. The pharmacies are becoming almost like an emergency room. But I really, I don't know. I'd like to say this to our viewers out there in YouTube land. This has been fascinating to me, and I think Fred too. And I have a feeling we've only touched the surface, and that we should really have you back again to talk about other and various other topics. Fred, do you have anything to add before we sign off?
As you and I say, I think that's a wrap. Thank
That's
you
a wrap.
very much,
Very
Russ,
much.
for
You're
being here today.
very cooperative and very helpful, and I hope that our viewers will get some information that's firsthand from a knowledgeable individual.
All right.
Doctor of Pharmacology, Russ Leaderhouse.
And I
Thank
got to
you.
get one in too.
Thank you, Fred.
Peanut Gallery. Hit me up.
Hey, all
Boom.
right, thanks.
Thanks, guys. Take
Sorry,
care.
sorry, I didn't mean to leave you out.